Today, we're going to look at a BodyViz Brain Builder about heart valves. The circulation of blood is important to making sure the cells of your body are receiving the nutrients and eliminating the waste they need to be able to carry out the functions of the body. Blood flow is accomplished by pumping actions of the heart and the proper functioning of the cardiovascular system. Blood passes through a valve before leaving the chamber of a heart, which prevents backflow of the blood. There are 4 valves of the heart: 2 atrioventricular valves and 2 semilunar valves. Let's start by looking at the atrioventricular valves. These valves separate the atriums and the ventricles, with the right AV valve, or tricuspid valve, between the right atrium and right ventricle, and the left AV valve, also known as the mitral valve, between the left atrium and left ventricle. They are each composed of 4 parts: the annulus fibrosus, which serves as the foundation of the AV valves, the valve cusps, which are thin sheets of tissue attached to the annulus, and when they overlap, they completely close the opening of the AV valve. The chordae tendineae, which are tough cords of connective tissue that attach to the ventricular margins of the valve cusp. And finally, the papillary muscles, which are cone-shaped pieces of ventricular muscle that project into the cavity of the ventricle from the ventricular wall. The 2 semilunar valves are located at the root of the aorta, as the aortic semilunar valve, and the root of the pulmonary trunk, as the pulmonary semilunar valve. The semilunar valves are comprised of 2 parts: 1, an annulus, which is the foundation of the valves, and 2, 3 semilunar cusps, which are small, thin leaflets of connective tissue. Next, we will look at the symptoms, causes, and treatments of heart valve disorders, and finally, give a patient example. Symptoms of a heart valve disorder include a heart murmur, which a doctor can hear with a stethoscope, chest pain, abdominal swelling, fatigue, swelling of the ankles or feet, dizziness and/or fainting, and an irregular heartbeat. Heart valve diseases may be present at birth, or can also occur in adults because of many causes and conditions. Here are some of the common causes. Regurgitation, which is when the valve flaps do not close properly and cause blood to backflow in your heart, which is common with prolapse. Stenosis, which is when the valve flaps become stiff and thick and possibly even fuse together. This causes the valve to become narrow and reduce blood flow. Atresia, which is when the valve isn't formed, so a thin sheet of tissue blocks the blood flow. Endocarditis, which is the inflammation of the heart valves. Rheumatic fever, syphilis, and other connective tissue disorders. Treatments for heart valve disorders depend on the severity of the disease. There are many different techniques to repair or replace a heart valve through surgery. Valvotomy is a procedure when the surgeon performs open heart surgery in order to separate valve cusps that have become fused together with stenosis. Percutaneous balloon valvuloplasty is when a catheter with a balloon is inserted into an artery or vein and passed into the heart through the affected valve. The surgeon then inflates the balloon and pulls the balloon back through the valve in an attempt to widen the valve. Transcutaneous valve replacement involves taking a replacement valve and crimping it onto a deflated balloon, which is then attached to a catheter and inserted into the femoral or brachial artery that is maneuvered into place. The balloon is then inflated, expanding the new valve, which is then surgically placed at the location of the damaged valve. Once the new valve is placed, the balloon is deflated and the catheter is removed. And finally, open heart surgery is used to fix a variety of other heart valve disorders. Let's take a look at a patient example. You receive your patient's file and take a look. Age, 30, gender, female, chief complaints, chest pain and dizziness. You invite the patient into your office for an examination. You notice from the vital signs that the nurse passed on to you that the heart rate seems a bit irregular. You take a listen for yourself with your stethoscope and can hear a heart murmur. You ask the patient about any other health issues. She explains how stressful her job is and how she is on high blood pressure medications and also faces sleep apnea. You send for an echocardiography, which shows the prolapse of the left AV valve. Open heart surgery is scheduled and performed to repair the prolapsed valve. This is a classic example of a heart valve disorder. Like this video and subscribe for more 3D anatomy.